Unfortunately, 20 million people are blind due to cataract. It is the major cause of blindness worldwide, so it is a very important ophthalmic disease. In this group of videos, we will try to help you to understand the pathology of the cataract and how you can manage patient with cataract. So you must watch the videos to the end. At the beginning, we must know the normal anatomy and physiology of the lens to be able to understand the pathology of the cataract. So the lens is a vascular transparent structure, biconvex in shape, lies behind the iris and in front of the vitreous body, separated from the vitreous body by the retrolental space, which contain an aqueous humor. The lens has the following structure: the anterior surface and the posterior surface. The anterior surface center is called the anterior bole, and the posterior surface center is called the posterior bole. This lens is covered by a very elastic capsule, which is formed by the underlying subcapsular epithelium. This capsule has a very elastic structure, which enables them to increase the refractive power of the lens, and has a very important function by providing nutrition to the lens, which is avascular, and to regulate the removal of the waste product of the lens metabolism. The edge of the lens is called the equator, which gives an attachment to the ciliary body through the suspensory ligaments. The lens has a central part called the nucleus and peripheral part called the cortex. The refractive power of the cortex is less than the refractive power of the nucleus. Due to that, the nucleus is formed of old sclerotic fibers, but the cortical surface has a thin and newly formed fibers. The subcapsular epithelium is absent behind the posterior surface, but it is present behind or underlying the anterior surface and the equator. The refractive power of the lens is equal to 18 diopter. This refractive power is more outside the eye more than inside the eye, because that the refractive power of any lens depends on the difference between the refractive indices of the two surfaces or two mediums in which the light passes through. So inside the eye, the light passes through the aqueous humor and the lens. The aqueous humor refractive index is equal to 1.3, and the refractive index of the lens is equal to 1.4. So the difference between them is 0.1. But outside the eye, the light passes through the air and the lens. The difference between the refractive indices of air and lens is equal to the refractive index of the air is 1 and the refractive index of the lens is 1.4. So the difference between them is 0.4. So this increase in the difference between the refractive indices outside refractive of the air and the lens enable make the lens more refractive power outside the eye. The second reason is that inside the eye the lens is stretched by the suspensory ligament, but when become outside the eye, this suspensory ligament or this stretch effect has been lost, so the anterior surface becomes more curved, increases the refractive power of the lens. The cataract is an opacity of the lens. Cataract divided into congenital and acquired cataract according to the presence of the cataract from birth or developed with age. From birth called congenital, developed with age this is called acquired. The acquired cataract is divided into whether it is senile cataract or traumatic cataract after trauma or complicated cataract after disease or surgery. Surgical classification of cataract is according to the age of the appearance of the cataract. If it appears before the age of 25, it's called soft cataract, and if it appears after the age of 25, it's called hard cataract. In the next video, we will focus on the first type, which is congenital cataract. Thank you. Good luck.